Thank you very much, Mr. Speaker. Mr. Speaker, a while ago I spent a week in intensive care. Not, I assure you, as a patient. But I remember well from that week how they were unable to admit a seriously sick patient because there were no beds free in the intensive care unit. And there were no beds free in intensive care because there are no beds free in the hospital. And the ward sister told me that that was because patients, particularly the elderly patients, were unable to be discharged because there was no care home for them to go to. And that she described at the time as bed blocking. Now that's a familiar story, particularly to those in the chamber this afternoon. But I should tell those here that that was 20 years ago. So delayed transfers of care, as we call it now, are nothing new. And the fact they're nothing new is a reminder that this is not a problem that will be easily solved. There are no easy answers. But that is not to say that we shouldn't try. And in fact, I believe that we should and we must try. We must address the problem of delayed transfers of care, not only because NHS hospitals need to use their beds for acutely sick people who need acute hospital care, but also because we know that being stuck in hospital when a patient is ready to go home, particularly for an old patient, is a very bad place to be. It is absolutely the worst place to be when you're an older patient and you could be at home and regaining your mobility as opposed to losing it being in a hospital bed. And we know that, in fact, a few weeks confined to a bed in an acute hospital can mean that an old person may, in fact, never, ever walk again, even though they went into hospital perfectly able to walk and live independently. And I say that from the experience that my own grandmother had. I very much appreciate the efforts that are being made across the system to solve this problem. I know that hospitals and social care across the country are working together now to speed up discharge, to put in place packages of care, to identify who needs single-handed versus double-handed care, to try and make best use of limited resources. And I know that work is going on in Kent, and in my constituency. A few months ago I convened a meeting between East Kent NHS Hospital and Kent County Council specifically to talk about what they're doing in this area to reduce delayed transfers of care. And I should credit Kent that over this year, delayed transfers of care have gone down significantly. They have approximately half between June of last year and June of this year. So it really is possible to make progress even under a tight financial situation. As I know that at a regional level, the sustainability and transformation plans, the devolution deals in places like Greater Manchester, emerging accountable care organisations, vanguards like Encompass in East Kent near me, they are really working on how to bring together health and social care and how to improve the situation with delayed transfers of care, recognising which they must, not only is this a priority, but they have to get above the questions of whose budget does the money come from, whose money is it, whose problem is it, whose patient is it, and look at the problem, at the issue as a whole, and look at the patient as an individual, and simply look at what care that patient needs, not whether it's in one part of the system or not. So I should say to everyone working on that, thank you very, very much indeed for your efforts across the country, because you're doing it not just to free up much needed beds, but also for the sake of individual patients who need that better care outside hospitals. But that brings me then to the question of money, because we do face a challenge as a society of people living longer and needing more care, and people rightly expecting better care. And in fact, thanks to the work of the CQC inspecting care homes and care providers, we are seeing transparency into the quality of care, and we are identifying where there is poor care. Now, thankfully, the vast majority, 70% or so, of care and care providers is good or outstanding, but there's a significant minority there that is not good enough, and very good to see that the majority of those, in turn, are actually improving. So, I welcome the improvements of care, driven in part by the CQC and the transparency. But we cannot get away, as I said, for the fact that there is a need for more money in the system. And that's actually something that we all know the government itself has recognised, even despite the large deficit and debt that was left by the Labour Party after 2010.
I don't think it's that funny, really.
We know that the government, even so, has committed to funding the NHS, funding the 5-year forward view, and increasing funding to social care. Social care funding is rising in real terms, and I personally enormously welcome the social care precept, the extra 2% that Kent and other councils are levying in order to increase the funding for social care. And something that I've noticed, at least in my area, I haven't heard a single person complain about that levy, about that increase in the amount of council tax they're paying, which I think shows a widespread support for actually funding more care. So we do know that where we can, there is a need, and it is a good thing, to spend money on social care as well as the commitment to funding the NHS. Though I would say that there's a case for some work to be done so that we know that any extra money that's spent on social care, actually what that will achieve, and to what extent might it help achieve savings in the NHS. Because when I've asked questions of experts in this area, there is a lot of vagueness about what actually will be achieved for the NHS in increasing spending in social care. But I think the final point, which I'd like to emphasise, Mr. Speaker, before I finish, is the importance in having a system which truly joins up health and social care, so that each pound is spent most effectively across both of those, and each person has the right care for them, not according to whether they're in the NHS or social services, but the right care for every individual person.